Hospitals struggle to care for COVID-19 patients as India surges past 500,000 cases. Hello, I'm Anand Naidu and this is The Heat. India is now fourth in the world for the highest number of coronavirus cases, following the United States, Brazil and Russia. Schools, cinemas, gyms and bars remain closed, but the Indian government is moving forward to ease some restrictions. On Tuesday, the Indian Prime Minister Narendra Modi announced the extension of a food grain program to help the country's poor. Let's get straight to our panel. Joining us now from New Delhi via Skype is Neha Dixit. She's an independent journalist. Also with us is Dr. Pankaj Solanki. He's a medical director and owner of a hospital dedicated to treating COVID-19 patients. Thanks to both of you for joining us. Dr. Solanki, let me start with you. We've seen a massive jump in the number of cases in India. We now have just over 600,000 people infected, with almost 18,000 people dying from the virus. That's since the lockdown was imposed in India. We've seen a very big jump in the last 2 days. What's driving these numbers so high?
But what has happened over the last month or so, the number of tests has been increased. And we understand that there was lockdown earlier, and because of which we would be able to contain the number and because of the less investigation. But over the time, as the investigations have been increased, the tests has been increased, the number is starting to come. But the good thing is that the mortality is only around 3% and the casualties. And the recovery rate is around 60% in India. So I'm suspecting the most of the cases in India are mildly symptomatic or asymptomatic.
So has testing, Dr. Solanki, been expanded in the last few days in India or the last few weeks?
Yeah, it has been expanded to a number of around 200,000 testings per day. So that's quite a significant number. And on the contrary, on the same side, we are getting only 10% of the people infected, maybe 18 to 20,000 per day, not more than that. So we have been able to contain the virus yet so far.
All right, let me bring in Neha. Neha, India also wants to reopen its economy, but the World Health Organization has warned that any kind of premature reopening of the economy could lead to a new wave of infections. What is your assessment of the manner and the way in which the Indian government has handled this pandemic?
There have been a number of responses, but widely a large number of people have been affected because this lockdown, 68-day lockdown imposed by the Indian government all across the country is actually seen as something which was unplanned. On 24th March, Prime Minister Narendra Modi announced the lockdown at 8 p.m. on national television, and it was effective from 12 midnight. But what happened was that several people were left stranded on the roads and couldn't do it, couldn't go anywhere, couldn't access basic supplies, couldn't ensure or prepare for this kind of lockdown, which was almost over 2 months long. I also want to point out that the worst affected were the informal workers in the country, including migrant workers. 80% of the workforce in India is from the informal sector. And the survey that was done initially to find out how many people had access to ration, over 50% of these informal workers did not have access to more than 1 day of food supplies. So that way they were particularly affected, and the way the government has responded with such a large population working in the informal sector, the ILO has predicted that 400 million workers from the informal sector in India will be pushed deeper into poverty, and the poverty rates are going to double up. So this lockdown, in which the way the Indian government imposed the lockdown and tried to buy time to create infrastructure for more testing facilities, to ensure that they are more prepared to handle a pandemic like this, that is nowhere to be seen. And in fact, more people are dying of starvation, more people are troubled because of lack of supplies, lack of food, instead of COVID-19, which is a dire situation.
Dr. Solanki, what about healthcare facilities in India, things like hospitals and clinics? You tweeted, actually, that your hospital has been ordered by the Delhi government to become a COVID facility, but that was actually putting great strains on you, especially on your finances. So how are you managing?
See, yes, I was, we were around 117 hospitals which were being asked to convert our facilities into a dedicated COVID setup. There were some financial repercussions earlier, and still there are, but those are the challenges we should accept, I believe. But they are the solution as well to those challenges. There, what has happened in these hospitals, the non-COVID patients have stopped coming. The normal patients which were earlier coming. So some footfall, some decrease in the footfall in the hospitals when you count those numbers of non-COVID patients. But yes, we are talking about the number of beds we have in Delhi itself. We have around 15,500 beds dedicated to COVID only, and out of which only 33% are occupied as of now. And if we talk about the ventilators, there are around 40% of ventilator beds are still empty now. So in terms of health facilities, we are doing good, but there are some challenges that I believe the government will take care of those, or we will find a solution in the meanwhile.
What about staffing, Dr. Solanki? Do you have enough adequately trained people to deal with the coronavirus pandemic?
Yeah, I have enough numbers as of now. There were challenges with the staff. There were people who did not want to work in the COVID setup. People had few reservations. They were denying because of the family pressure, or they do not want to because of some taboo thing. They don't want to work. But I found some few good people, those who are working in the facility and are helping me in managing the things. Yes, the number may be less. They might be overworked, but they are doing a wonderful job as of now.
Neha, I want to get back to something you mentioned a moment ago, and that is the question of food in the country. The government has implemented a scheme whereby it would extend food grain supplies to the country's poor. But you pointed out that a lot of people are actually dying from starvation. So is that program not working?
The food, it was only yesterday that PM Modi announced on television that a program like this will be implemented. But as of now, there are various independent surveys and research done by independent groups, and it suggests that most of the workers, 70% of them did not get food supplies from the government. Instead, it was civil society, it was volunteers who were actually distributing food till now. So from March 24th till the last week of June, says government was nowhere to be seen. In fact, the government also started a new fund called PM Cares Fund, even though we already had a PM Relief Fund in this country. And a lot of donation was collected. Lots of common citizens did donate to that PM Cares new fund, but it was not. The government said that it cannot be audited. So, which is why we don't know, even when the money was there, why the ration did not reach people. In fact, this kind of lockdown, and after the lockdown also, even though some things have opened up now, the farmers, it has completely broken the supply chain. So even the farmers, the small scale farmers, medium scale farmers, they've been pushed deeper into debt, and the supply chain has completely broken down. There is a kind of informal economy where in the food supplies as well. So it is right from cultivating to bringing them to the market to even bringing it to the doorstep in urban spaces. It is all this informal
Right.
chain for food supply. Even that is broken. So the worst affected again are the people from socioeconomically marginalized backgrounds. So it is pretty late in the day for the government to actually
Yeah.
announce this kind of scheme after almost 3 months.
Right. Dr. Solanki, you yourself were infected with the coronavirus. How did that affect you?
See, I have been working continuously in the hospital since the lockdown. I cannot just shut down my hospital and go home. I have been seeing the patient, so I might have contracted the virus from a patient only. But what has happened, the symptoms were mild, and I could able to contain myself into a room for 14 days maybe now. So I've been doing good, and the good thing is that my report today came negative, so I'm quite happy about it. So in general, I believe that this is part of my job. If I get infected from a patient, I should not be complaining about it, and I did not complain about it. See, since if I'm treating someone, this is bound to happen. I cannot shy away from my duties.
Do you have enough protective equipment for your staff?
I have enough. I have enough. I'm providing them each and everything, whatever it could be, proper donning and doffing area. and all the facilities anywhere it could be provided. I'm providing all those facilities to my staff.
We've also heard, Dr. Solanki, that many of the people who've been infected by the virus have been stigmatized. What's been your experience?
See, I've not been stigmatized at all. I would not say that there were few incidences reported in the month of April, within a week or 2 weeks. There were people who were asked to leave, the doctors are asked to leave the society. But in general, I would say the people have been welcoming to me wherever I go, where I have been to. People do appreciate my work. They keep on sending me messages every day, like, please take care of yourself, please take care of yourself. Even if when I was not infected, they were very concerned about me. They were always open to me if I need something or if there is something they can do to help me. So the civil society has been helpful so far. There were few incidences which, yes, we do accept, but that we cannot help.
Neha, the World Health Organization has warned that the pandemic is nowhere near over. This is what the WHO Director General had to say. Let's listen to this.
The critical question that all countries will face in the coming months is how to live with this virus. That is the new normal. We all want this to be over. We all want to get on with our lives. But the hard reality is this is not even close to being over.
So Neha, that's a very stark message there from the WHO. Is that message getting through to Indians? Are people complying with these restrictions? Are they wearing masks? Are they maintaining social distancing?
I would say yes and no at the same time. Yes, people are more cautious than before, but at the same time, I would say that this kind, for example, social distancing is also a sort of privilege. The privilege that urban middle class families, urban middle class people can afford. But workers who are living in cramped spaces, who don't have running water, who don't have other basic means, basic amenities, for them to actually go out and buy soap or to buy food or to maintain social distance is not possible. So I would say yes.
Right.
Also, after some portions of the country have opened up, people are coming out, and there is because they've suffered acute crisis, and I'm not even talking about businesses, I'm talking about daily wage laborers. There is a lot of desperation to find work, and in order to find work, a lot of things they cannot really afford to follow. So yes and no at the same time.
Right. Dr. Solanki, I've just got a few seconds left. I want to ask you about a vaccine that's being tested in India. This is the first government-approved anti-corona vaccine. The drug is called Covaxin. What can you tell us about this drug?
See, the vaccine has been approved for the clinical trials as of now. There are not much promising results because still in the trial phase. We are hoping that it works and it brings some change in the society so that we do not stick to the new normal. We stick to the normalcy as it was earlier before. But I firmly believe it will take at least 3 to 4 months to have a vaccine or to have a cure of the virus.
Right. Okay, that's where we have to leave it. Thanks to our guests, Dr. Pankaj Solanki and Neha Dixit. More of our conversation about the impact of coronavirus in India right after this. Stay with us. You're watching the news.
The nature of business is to bring value. Business activities in Europe, Asia, and the U.S. reach consumers globally. Trade, manufacturing, energy, high-tech, real estate, consumption. We give an expanded view on global business and how it covers, influences, or relates to the whole world. Global business, only on CGTN.
Whether it's about your education, the home you live in, or the items you buy, your money has a story to tell. Because every business story is a human story. Global Business.
Welcome. Welcome back to the heat. When India issued a national lockdown in late March, the capital of New Delhi reported 600 COVID-19 cases. Now health officials are preparing for as many as 500,000 cases by the end of July. For more on the situation in New Delhi, we turn now to Somrita Ghosh. She's a health correspondent for the New Indian Express. And Dr. Harjit Singh Bhatti is a senior resident of internal medicine and the national president of Progressive Medicos and Scientists Forum. Thanks to both of you for being with us. Dr. Bhatti, let me start with you. India has reported over 500,000 infections and the number of deaths are close to 17,000. The Prime Minister Narendra Modi says the death rate is, quote, under control, but the country, he says, is also at a very critical juncture right now. What is your assessment of the pandemic right now in India?
Now number of cases are on rise, and every day we are seeing lots of patients who are coming to hospitals, and even we are seeing that many patients who are having positive reports for two or 3 days, and they are coming to hospital because they are telling that they are not getting hospital beds or they are not getting admission. And so overall the number of cases are rising and the situation is worrisome, and we are seeing upsurge of infection in population.
As far as hospital beds are concerned, does India have the necessary health infrastructure to cope with a pandemic of this size? We have heard reports that people have been turned away from some hospitals.
Yeah, India's healthcare system is actually a very complicated system, because we have almost 30 states. 30 states have their different healthcare system, and apart from that, most of our healthcare system, like almost 70% of healthcare system, is in private sector, like corporate sector, which only allows you to get treatment only when you can pay for it. So public healthcare sector is a very limited. And now during pandemic time, during corona time, we are seeing only public healthcare sector is the only hope left for most of India's population. So, and the public healthcare sector was not getting the required attention from quite a long period of time. Means we have seen that our governments were slowly pushing our healthcare system towards corporate or insurance based models, and they are not working properly to strengthen public healthcare system. Even if you can see, the investment from government is only around 1.2 or 1.3% of India's GDP, which is a very meager amount as compared to the large number of population we have, or the way this healthcare system must function. So overall, India's healthcare system, public healthcare system, was not in a very good shape, and it was already crippling. And now we are means we have to depend on it. And the second thing is the strength of healthcare workers. In public sector, there is very less number of doctors, nurses, and even the hospital beds were very less. So overall infrastructure and manpower both were restricted or very less in public healthcare sector, and we are depending on that. So that's why we are seeing a more severe crisis than it's yeah.
Okay, let me bring Somrita into the conversation. Somrita, the Prime Minister, Narendra Modi, he says that thousands of lives have been saved because of the lockdown that the government put in place on March 25th. But are we getting a clear picture of what the situation is in the country? I mean, the figures that we're hearing, are they a true representation of what's going on?
Well, yes, if you see the implementation of the lockdown, it has been successful up to extent. Well, there are different opinions that how much the lockdown has impacted, but maybe the lockdown could have been implemented 10 days before it was announced officially. It was announced at the end of March. It could have been implemented middle of March. The number of cases possibly would have been much less as it is now. But still, to say the number of cases, considering the population that India has, is much under control. But if the rules are yet not followed, the social distancing norms are not followed, the preventive cares are not followed, and there's a mounting pressure on the healthcare system. So yeah, the cases might rise.
Dr. Bhatti, there has been some concern over staffing at hospitals. This has been addressed by the acting health minister. This is what he had to say. Manish Sisodia, this is what he said about staffing. Let's listen.
Staffing is a huge challenge to find trained and experienced medical staff. Again, I'm going to say no country's medical system is designed for such a huge pandemic. Nothing like this has happened in the last 100 years. It's never been heard of. So in a situation like that, availability of medical staff is a huge challenge.
So, Dr. Bhatti, how serious is this?
Yeah, this is a very serious thing, but our policymakers and our leaders must understand this thing, that India's population was itself very large from very beginning, and this is the new virus which came into existence, but we are seeing other infectious diseases also, and because of those infectious diseases we are seeing lots and lots people are dying. Even tuberculosis, which is almost vanished from all over the world, and we are still struggling with the tuberculosis. Even after these type of things, our policymakers, our governments have never seen recruiting more healthcare workers. I have not seen any recruitment drive till now. Means we are 6 months into the coronavirus, and there is almost half an year we have spent into with this virus, but still there is no recruitment drives. And even if the recruitment drives was also going on, that too is very much like a type of contractual recruitments only. So overall, the government says that we have less number of healthcare workers. This is definitely a true thing, true fact. But what the government is doing to increase manpower, these things is the biggest challenge which always comes. And we know that when you have to recruit more people, then you have to invest more into the healthcare system, then you have to build that type of infrastructure so that you can recruit those people to those places. So overall, this needs a very means attention from the government, and this needs a lots of investment. So government or our policymakers won't go to that side, and instead they just says that the whole world is struggling with the healthcare workers, but with the manpower. But even there are many doctors who wants to join a government sector, and they are in lakhs who wants to join government sector. But where are the recruitment drives? Means what are the government doing to recruit manpower? That is the major question now.
Right. Somrita, the Delhi government says that it's established a COVID care center. It's the largest facility of its kind.
Yes.
It will ultimately make about 10,000 beds available. At the moment, there are 2,000 beds available. What kind of relief will that provide to public hospitals?
The setup that the makeshift hospital has come up, it's obviously an added advantage. Like, if the cases goes more, the cases rises more, you can obviously have the option to shift patients to these to the temporary hospital that has come up. There's 10,000 beds, so and it has oxygen, it has got ventilators, got the workers to look after. So the pressure on the hospitals are likely to come down, because now there's a tremendous pressure on the healthcare workers, on the administrators. So it is expected that the hospitals will be in a better situation to handle and particularly give more attention to the critical patients, because in India, most of the patients are asymptomatic, who doesn't need more of care. So the focus is on saving the critical patients, the critical lives, and that can be attended.
Dr. Bhatti, medical personnel, including doctors like yourself, are at risk with this pandemic. Are you getting adequate protection? Is there enough personal protective equipment, PPEs as they're known, while you go about your work?
And now most of the centers and most of the hospitals are getting adequate PPEs, and even the government's initiative towards PPE is very good. Means we have started manufacturing lots of PPEs, and many of the public service units, PSUs, were involved into manufacturing PPEs. So overall, people are getting PPEs. Only small nursing homes, small hospitals who are not able to buy PPEs, and they are not able to afford it, only those centers were not getting. But overall, rest of the healthcare workers are now adequately protected.
Somrita, officials have announced a very ambitious program in Delhi. It's door-to-door screenings of all of Delhi's 29 million residents. What kind of response has there been to that? Because there have been also cases that we've been hearing about where people have tested positive, that have been stigmatized.
So the stigma is mostly from the the ghettos and the clusters, where people are afraid that once they are identified as a COVID positive, they might be pushed towards the hospitals and the COVID care centers. They might prefer to stay at home, but they won't be allowed because of the stigma, as we said. As far as the response and the process of the door-to-door sample testing and the sample is going on, it is so far smooth because at the end, what people by now have realized that if they don't come up, if they don't get themselves tested, there's a risk that the infection might spread to their own family. They might have a chance of losing their life. They might succumb to the virus. So people are cooperating with the government. They are showing their interest. They want to get themselves tested.
Dr. Bhatti, what about social distancing in India? It's a very densely populated country, especially in the cities. How difficult would it be, or is it, for people to maintain social distancing?
It's a very, very difficult thing. That's why lockdown was imposed such an early stage, and even the implementation was very strict by the government. But everything have a limitation, and so the government has to ease the lockdown. But overall, maintaining a physical distancing of a 6 feet distance is a very difficult thing. Mostly in rural areas and mostly in our we have seen in with the migrants. I myself do health camps into the construction workers, the migrant workers, and I have seen by myself that it's very difficult for them to maintain a social distancing because in a single house, in a single room, five, six, or even sometimes 7 to 10 people were living. So overall, in few of the this physical distancing is very much a privileged thing, and only few privileged people can get. Most of India's population is where finding it very difficult to maintain.
Okay, and that's where we have to leave it. Thanks to both of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.